Meeting room.
If you're looking for Representative Woodman, he just stuck his head in and he's about to sign on.
Oh,
Yeah.
okay. Representative Page, yes, got it.
Yeah, Page, yeah,
Okay.
sorry. Not-
Okay. Still getting some people coming in here, so give it a few minutes. All right. Why don't we get started? Thank you everyone for coming today. Appreciate it. We have Mike Fisher and Sean Londergan from they actually work at Vermont Legal Aid, but they both do different things. So great to have you both here today. I don't know if you two have spoken about who wants to start, but Michael, do you want me to put you on the spot? You want to start first, or Sean?
I was going to suggest that Sean, why don't you do an introduction and I'll follow up. And
Perfect.
Okay. Yes. So my name is Sean Londergan, and I'm the state Long Term Care Ombudsman. I do, which is a project of Vermont Legal Aid. So I am an employee of Vermont Legal Aid, and with a staff of, there's a state ombudsman, and then there's also 6 local ombudsmen. And so there are ombudsmen in each of our offices, Vermont Legal Aid's offices. So we have Burlington, St. Johnsbury, Montpelier, Rutland, and Springfield. And so our staff is such that each county in the state of Vermont is covered. And Vermont Long Term Care Ombudsman Project, we're advocates for residents of nursing homes, assisted living residences, and residential care homes. And we also advocate for individuals who receive their long-term care Medicaid benefit choices for care in a community setting, such as their home. And what we do is a big part of our job is advocating for residents, and we deal with concerns and issues that residents may have with their long-term care services and supports. So we try to assist them with working through those problems and issues. And so I guess that would be my quick introduction. So I guess I'll throw it over to Mike.
good afternoon, everyone. I'm Mike Fisher. I'm the state healthcare advocate, and very much like Sean just described, this is a position defined in state statute that is contracted over to Vermont Legal Aid. And so we run the shop, which means we have a advocacy shop where we have 8 advocates on the phone today responding to Vermonters' access to care challenges. Eligibility to get support from us is that you're a Vermonter. So we're not particularly focused on age, though I will say, this being the Older Vermonters Caucus, that we get a lot of calls from older Vermonters who are trying to maneuver through our very crazy healthcare system and our very crazy third-party payer system as people try and get the care they need. And then we also have a policy shop where we advocate on behalf of Vermonters in the regulatory and legislative arenas. Sean, do you want to? Sean and I did not coordinate one bit, so.
Right. And so I just add on to that. Yes, we are also the Vermont Long-Term Care Ombudsman Program. We are also, I guess, authorized under Vermont statute. And additionally to that, there's also federal regulation. So in each state, in order to get money from the Older Americans Act, has to have an ombudsman program. So in Vermont, as Mike said, the ombudsman program's contracted out. Some other states have their ombudsman program right in state government, but each state has an ombudsman program. And so I just wanted to emphasize that point. And I could also kind of share in the sense of we do wanted to make sure that, if individuals have issues about long-term care, or there's constituents that contact the legislators regarding long-term care issues. I guess we do have a list of ombudsmen that can be contacted directly, and so our staff. So I just want to mention, we just submitted our legislative report, and so I think that's a good piece of work that our office has recently put out. And within that report is contact information for staff. And the other thing I just want to emphasize is that we are independent. So even though our name is Vermont Long Term Care Ombudsman Project, people sometimes get confused. And so we're independent from the state. So people do have a big concern, maybe sometimes in contacting us to in regards to confidentiality. So I just wanted to make that point.
I see a hand, Tracy.
Yes, hi. Thanks for your presentation. It's nice to see you here today. I'm curious to know of all the issues that are sort of bubbling up to the top. So, the area agencies on aging also have a helpline, and I probably could tell you, there are 100 reasons why people call us, but of the top, in those, we're finding issues related to workforce development. We're finding issues related to housing, discrimination with people particularly people who have disabilities. So what I'm curious about is, what are the top sort of issues that you're finding are bubbling up to the top? I'd be curious to see if those sort of align with what we're finding.
So I guess I could take that one first. So I guess the issues that we've kind of identified as kind of priorities based on the work that we've done over the last fiscal year would be staffing. So staffing at all, at long-term nursing homes, residential care homes, assisted living, and also at home health agencies. The staffing was an issue prior to COVID, and it's only become exacerbated. And due to the pandemic. So that's number one issue. I guess number two issue would be quality of care. So rightfully so, during the pandemic, there was a focus on COVID in facilities, for example, infection control, prevention, and trying to make sure that facilities are safe as possible in terms of COVID. But so that kind of took over, and due to also the staffing issue, kind of quality of care. So in terms of our complaints, quality of care issues were approximately of all our complaints, 35% of complaints. So quality of care as a second issue, in the sense of like a diminished quality of care we've kind of observed over the last fiscal year. And I guess the third issue that we would point to would be social isolation due to COVID, in the sense of, facilities, for example, were locked down for a big portion of the pandemic. And so, it's come back, and it's much better than it was. But the effects of kind of like lockdowns and individuals not being able to see loved ones or friends that are in a facility setting was the third issue. So if I was going to name the top three, those would be the top three issues from our perspective.
And I guess I want to spend just a few minutes talking about the work in front of us, in front of the legislature this year. We've been spending a decent amount of time talking to Vermonters about medical debt. And I want to give a shout out to Meg Polite, who has spent a little time working with us on this project a little while ago, before she was in her current role. And so I spent a few minutes. Medical debt's interesting. everybody knows this story. It's really incredible. When I talk to people, it doesn't matter if I'm talking to a hospital executive or the like, people know people with medical debt. But I spent a few minutes earlier today looking at some of the stories that we heard from people who were on Medicare. And despite the fact, and part of my mandate is to bring consumer voices forward. And so I'm going to spend just a minute reading just a few very brief quotes. I put off going to the doctor with increased frequency now that I'm retired and on Medicare. This was not a problem when I had good medical insurance. I constantly put off care. I have insurance, but never know what my obligations will be. I needed cancer lung CAT scan, but had no insurance and couldn't afford it. $1,750. Simply could not afford to incur medical debt. Constant worrying and stress. I paid for my medical debt with my pension and savings. Medical debt makes life scarier. So again, this is not a news story. I think, and I know that everybody here, be you a legislator or an advocate, know this story. But that is the motivation behind a significant motivation behind our advocacy this year. And so with that in mind, I think there's 3 bills I want to mention that are currently in play. One of them is H287, which is in the House Healthcare Committee. Hello, Representative Page, who's heard me talk about this a number of times. And by the way, there's a great 7 Days story today that came out today on this, and encourage you to look at it. And I can paste a link into the chat when we have a moment, or when I have a moment. So I am hopeful that we're going to be able to move some portion of this bill forward to create a statewide minimum standard at Vermont hospitals, so that more of the people who get sent to collections who have medical debt instead get considered for hospital-free care policies. A second bill that's in play, S239, creates an annual open enrollment period for Medigap plans. In Vermont, and in much of the country for that matter, people can buy a Medigap plan, a supplemental plan, for one open enrollment period, 1 6-month period, once they become eligible for it, after they get a Part B plan. And this bill would provide for an annual open enrollment period, the same way we do for almost every other type of health insurance. And we propose to do that consistent with Part D open enrollment periods. That bill, S239, is in Senate Health and Welfare. They did some very brief testimony on it, or walk through the bill, and have expressed interest in pursuing it. And we actually are honestly, I think, still in a place of looking for witnesses. I know that Cove and the AAAs have expressed interest in testifying, and if there are others, you can let me know, or Senator Hooker, who's the lead on that. And then the last bill I want to mention is a bill that we've been promoting for a while. It was, or a concept that we've been promoting for a while, introduced by Representative Noyes, H637, to increase the income eligibility thresholds for Medicare savings plans. A handful of states have done better than us on this. I think it's shocking for many people to learn that when they turn 65, they lose the supports they had for Medicaid, that the eligibility is worse for people above the age of 65. And this bill would attempt to provide for some better supports for some very low income people on Medicare. And that bill is currently in House Human Services, it's going to need some work to move it along. It's going to cost some money to move it along, honestly. So it is a longer term project, but one that we intend to keep pushing on for as long as it takes. That's sort of my brief introduction of sort of the work we're engaged in here that crosses the paths with older Vermonters that we're engaged in here in the State House this year.
Mike Fisher is the healthcare advocate.
I noticed, Ruby, you have your hand up. You have a question.
Mike, can you speak to the Medigap bill and what the intersection is between that bill and Medigap and Medicare Advantage, which are
Sure.
different things?
Sure, I can attempt to, but I guess I want to recognize that there's probably people on this screen who know way more than me about this. But let me lay out what I understand, and I want to encourage conversation about it. When people buy an Advantage plan, or I should say a Part C plan, they have a year within which that they can choose to stay with it or leave it and be able to come back into the marketplace. Many people discover that the plan that they bought, even though a famous football star was promoting it, doesn't serve they discover it doesn't serve their needs well when they start to need care. Now, if that happens within a short period of time, then they can leave it, but often it takes longer than a year. And the way that crosses with Medigap is that if you don't buy your Medigap and your supplemental plan in that first 6-month period, you lose the guaranteed issue that everyone has during that 6-month period, and you are subject to a penalty that is about $75 per month for the rest of your life. So the person that has hung out on a Part C plan for a year discovers it's no good and wants to leave it and go back to traditional Medicaid is stuck with a even more expensive Medigap plan. And so creating an annual open enrollment period where people would have the protections they currently have of guaranteed issue would give people the opportunity of shifting back to traditional Medicaid. How did I do, you experts out there?
Traditional Medicare, right?
Yes.
Okay, perfect. Thank you. And this bill also creates a working group around Medicare Advantage. Am I correct?
It creates a working group. One of the areas we've identified as a particularly a large vulnerable population is the number of Vermonters on Medicare with no secondary coverage. Those people are highly exposed. 20% of a hospital stay will kill anybody's savings. And so there's a relatively, I don't have that number in front of me. There's a relatively large number of Vermonters that we consider highly exposed, highly underinsured in this category. And it's a real interesting policy discussion. What should we do to provide for better coverage for this group? So that's my frame of what I would be hopeful that the working group would engage in.
Great, thank you. Mary, I see you have your hand up.
Yes, hi, Mary Hayden, Vermont Association of Area Agencies on Aging, representing the AAAs, the Area Agencies on Aging. I think there's about 10 of us on the call today. And this is a very important subject to the AAAs, as I know you're all aware. And I have another Advantage related question specific to S239. And is there an expectation? I think right now the Advantage is mentioned only in Section 2 with regard to the stakeholder group. Will that be the extent of the attention paid to Advantage plans in the bill? And also just to mention that what an increase in the number of people needing assistance regarding Advantage plans has occurred for the AAAs who administer and provide Medicare counseling and education and outreach and training. So that's it. Thanks.
So Mary, I want to recognize that I'm open. And I would hope people who have suggestions about ways the bill could be improved, would love to hear it. We drafted this bill with Representative Durfee in the House side a year ago, honestly, without Advantage in mind. We were just focused on supplemental. But I think my most basic question in response to your question is, where is their state option? This is a fully federally regulated world. It's very unfair that a supplemental plan is regulated by the state, and even the advertisement of it is regulated by the state, but an Advantage plan isn't. So if there are ways and options for the state to take action to protect Vermonters from Advantage plans, I'm all ears.
Great. Meg, I see you have your hand up.
Yeah, I just wanted to ditto the comments about the Advantage plans. I'm Meg Burmeister, the Executive Director at the Northeast Kingdom Council on Aging. And certainly through open enrollment this year, we saw people being really outright manipulated into Advantage plans. Their prior programs calling them, telling them that this would be so much better and more cost effective for them. We just had a meeting a couple weeks back with one of our local hospitals who's getting denials from all of these Advantage plans, even though people are approved, they're on their provider list. And the consequence additionally is people then looking for rehabilitation in a nursing home who are really finding a lot of roadblocks from the Advantage plans. What was presented to them is certainly not accurately what they can expect to experience. And there is a significant push from the federal government to bolster people using these plans, which makes it really complicated. You know, we've had people calling in tears, not knowing what to do because we're telling them, you know, about their benefit, and then the hospital's telling them that's not the way it's really working. So it certainly is an issue and an area that should be focused on.
Can I also just add in that sort of on the flip side of what's happening at AAAs, the Cove team on the other end of that spectrum is dealing with people who are being scammed and defrauded as a result of Medicare Advantage plans. And we're really trying to find the line between misleading advertising and scam and walk a little closer to that line. And I think that is a space where we can use education, but where we can also leverage some assistance from, you know, potentially the Attorney General's office and from other parts of state government to recognize that misleading information or inaccurately represented information puts people at risk. And so while we may not be able to regulate Medicare Advantage, we can engage in counter campaigns.
Yeah, good point, Ruby. Thank you. Hey, I just wanted to, while we have Mike here, go back to the 637, which is the Medicare Savings Plan bill that we have in. And I know a lot of the AAAs and anyone who works with older Vermonters through case management, these situations come up where somebody is just missed the eligibility, or I heard one last week where the individual got a COLA on their Social Security, which put them over the limit, and they had to pay an additional $130 or something like that to be able to have access to. And I think if we can, if we hear from people, if you hear people that you know, losing eligibility for this, and maybe Michael, you could speak to this a little bit. You know, is there a way that we can make sure we hear about it here in the legislature so that we can maybe get some traction on having this bill taken up? And whether or not it gets taken up this part of the legislative session, we'll try to get it in the next one as well. But the more people are talking to their representatives, or, you know, that this is a concern, and they can tie it to an individual who will reach out to their rep, the more opportunity we'll have of seeing some action on this bill. So I don't know if you can just talk about that a little bit, Mike. That'd be.
I think you asked a few questions I'm not really sure I know the answer to. I think, but I think bringing people forward who are in this place is a great idea. We would love to talk to them at the Healthcare Advocates Office and collect their stories to bring it to the legislature. Why don't I just spend just a minute saying what the bill does? It moves Vermont's eligibility for the MSP programs to the Connecticut levels. And so Quimby moves from Vermont's at 100% of FPL, and it moves it to 211% of FPL. And I'm not going to say all the other numbers, but they're kind of in line of moving it up to a much more reasonable eligibility level to make sure those people have coverage and the associated supports like extra help. So I actually think, you know, there's often a discussion around the State House, what can we do for people around affordability of prescription drugs? This one on the face of it doesn't look like that, but it really is. It's taking a population of people and making sure they have the federal supports for prescription drugs, and would take them, and this might be a little, I'd be interested in people's perspective of this. It would move people off of the Vermont supports, the VFARM programs, and into the extra help category. And there's pros and cons to that. I want to just recognize that. One pro is that it wouldn't cost the state money. And so that would free up some money to be able to do more. But I think, you know, Dan, your frame is exactly right. You know, how do we build momentum on this issue so that when we come back next year, there's sort of this the ball is rolling, and the legislature and it's in front of the legislature quickly to address it.
Mary Alice, I see you have your hand up.
Yes, I came in late, but I just want to thank Mike for all he's doing and all of you. But I think this S637 would help me to get some drug help because I would be in that level. So thank you for that bill. I hadn't checked that one out. But I just wanted to mention how important it is to work nationally for a single payer system. I think all of you on here know that. We really need to work nationally, and we need to elect somebody for our representative in Washington who will really work on this. We have a representative now who's going to be a senator, and he speaks a good word on it, but he doesn't do anything. So I just hope, and I probably will vote for him for senator, but I just feel we need some work from our delegation. And I'm a member of Vermont Healthcare for All. I'm a member of the Vermont League of Women Voters. They're working on healthcare. I'm a member of the one-payer states. There are only 8 states in the union who have written down something like Act 48, which says, you know, we need to get rid of one care, and we need to take this on as a state thing and tax wealthier people and corporations. Thank you.
Thank you, Mary Alice.
Thank you, Mary Alice. I don't know if anybody else has a question or comment.
Can I also, this is not my world, but I also understand there was some discussion about the personal needs allowance, and I just want to make sure that gets mentioned as part of our advocacy here.
Yeah, that actually came up in our committee today, I believe. Teresa, I'm not sure if you're on with us right now, but
Yep,
the personal needs allowance that was talked about. You want to?
sure. Some people might know that former Representative Sandy Haas worked on a bill in 2009 for 2019 FY20 that increased the personal needs allowance, and that's a small amount of money that people in nursing facilities each get each month to do exactly what it says, pay for personal needs. And it hadn't been raised in a long time. We bumped it up by $25. And so what we talked about this morning, we are just discussing recommendations. You know, we haven't decided on anything, but one of the recommendations that came from the subgroup is to increase that by 10% and then to have an annual inflationary feature so that we don't have to kind of keep coming back and doing this. And so frankly, it doesn't get lost in the shuffle because it's a relatively small amount of money in the, I mean, it's a very small amount of money in the overall state budget, but it means a great deal to people living in nursing homes in terms of their ability to buy a small gift for a grandchild or to send a card or, you know, to buy a special shampoo or something like that, all things that lots of us may take for granted. So, so that did come out in our recommendation from our subcommittee today. So as well as, you know, we are looking at a number of different things. People may know in the administration's budget, there were some additional positions in licensing and protection and in APS, Adult Protective Services, all related to quality of care and long-term care services and response to complaints in APS. And so our small subgroup recommended that the committee accept those recommendations and add to them, frankly, in the area of developmental disability services. So we are looking at all of that in our in a draft of our budget memo that is due next week to appropriations.
Great, thank you. Honor, I see you have your hand up.
Yes, hi, Honor Horton. I'm the Executive Director of Hunger Free Vermont. And Sean, maybe this question is directed to you. So I'm curious to know whether when people call you around, or maybe it's directed to both of you, actually, when folks call you being challenged with some of these top issues and particularly things like medical debt and other things like that, are they also talking to you about the consequences of that for them, like not being able to afford enough food or having to choose between having enough money to buy healthy food and having to pay off their debt? And are you getting those kinds of stories?
Yeah, Honora, thank you for raising that. I in my focus on healthcare, I have been focused on the impacts of medical debt on people's ability to get care. I am attempting to move healthcare policy wonks in this area, and you know, right care at the right time is what everybody says is the goal. And so to drive home the point that medical debt interferes with that policy goal. But you're absolutely right. And when we hear from people who are really struggling with medical debt, the story, like any debt, the story is they can't meet their basic needs. So we do hear those stories.
Thank you.
Thank you.
And I'm just wondering,
Andrew,
Sean, are you able to share the link to your report in the chat box for people who haven't seen it. I think it's a pretty informative, easy to read report, and I would suggest that people take a look at it. And honestly, some of the recommendations that we're seeing in the jail budget directly relate to responding to some of the things that the Ombudsman's office raised in their report. So I think it's important for people to read it, and we hadn't really spent too much time on that. So I just wanted to highlight that.
Yeah, I can do that.
Great, thank you. I see Angela has your hand up, and Representative Smith, I also see you. I'm going to get to you next, but Angela.
Sure, I can be brief. Thank you. Angela Smith-Jang with Dale here. Really appreciate this conversation today. This is such an important topic, both for the health and well-being for older Vermonters and really for all of us as we age, and for the financial security of as we age as well. So I just wanted to mention too, I think the immediate work on these this legislation and looking at health benefits is incredibly important. I also want to keep the long-term planning in mind as well. Part of what we learned from the last needs assessments for the state plan on aging, we asked a question to people about, what insurance do you have now? Also, how are you planning for long-term care in the future, knowing that 2/3 of us will need long-term care at some point in our lives? And the vast majority of, or at least about half of people, did not know how they were going to pay for long-term care, or assumed that it would be paid for by Medicare. So there's definitely a real need for more education early on. I would say much, we can't start that education with people at age 65. We really need to begin much earlier so that people can plan mindfully for those needs as they come along. So I have that in my mind as we're thinking about some of the long-term planning around the action plan for aging well and other things. So just wanted to bring that piece up as we think short-term and long-term. But thank you for this good conversation.
And there's actually a bill on a long-term care insurance plan that's been in the House. I was trying to pull the bill number up real quick, but I couldn't. Representative Iacovone has put that in a number of times. So maybe at some point we can revisit that. Apparently it was, it had passed one of the bodies here in the legislature a number of years ago. I'm not sure if it was the House or the Senate, but it did have some action at one point. So something we probably will be talking about eventually. Representative Smith, thanks for joining us today. Appreciate it.
Thank you, Dan. I appreciate it as well. My name is Brian Smith. I represent Orleans 1 up in the Northeast Kingdom, and one of the reps. And something has come to my mind, and I don't know if this is the correct caucus to bring it up in, but I'm gonna start. Hopefully, someone can tell me what direction to go in. We do not have a facility in the Northeast Kingdom to accommodate recovering alcoholics. There's Valley Vista, and Maple Leaf is closed. Brattleboro Retreat is 250 miles away, or wherever it is. But I've come to realize that there's a serious need for a facility in the Northeast Kingdom to accommodate many, many people that need help and don't know where to go to get it. I'm talking retirees as well as people, young people. Right now, there's a facility available. It was the Derby Green facility. It was a nursing home. I believe it was a 23-bed nursing home. And it sits on 7 acres. The building is extremely structurally well built. And if anybody in this caucus has any idea, I've reached out to various businesses and departments in Vermont, and everybody sounds really excited about it. Yeah, great idea, and then no follow-up. So I need some help from somebody. This building is for sale right now, and it's available. And if anybody in this caucus has any information that would help me get this off the ground, my bsmith@leg.state.vt.us. I sure would appreciate some help.
Dan, can I just jump in really briefly and respond to the previous conversation?
I was hoping you would, Mike.
I'm sorry, Brian. I was on the one before you. Representative Yakavon's age 30. I hadn't looked at that. Thanks for drawing my attention to it. Just to say that there's a few states that have done some really, or poised to do some really interesting things. Washington, the public long-term care insurance model, and California has been doing some modeling on it as well. And this goes directly to Mary Alice's comment earlier. Here's a place where the public really, I think, could and should step in to provide coverage for this real need.
I guess the only thing I would say about the previous conversation too is that how many calls we do get from people that are really confused about long-term care, in the sense of once they kind of get involved in it, and many people don't spend time thinking about long-term care until either they have a need for themselves or a loved one. So it is really complicated. And I do know of the bill that you're talking about. I think it sets up kind of looking at a group, a study group to kind of look at a public option. And so I just want to reiterate that we do receive a lot of inquiries from people just saying, and as we're talking to them, just how complicated and confusing and how uninformed people are about that they are, going into kind of trying to find care for people. And I do think that would be a great thing if we were more proactive and changing, I guess, the level of knowledge about long-term care and how important it is. So.
Yeah, thank you.
Ginny's hand up.
I see Ginny. I saw you in the chat. So did you have a question, Ginny, or you want to make a comment?
Yeah, I had to jump up a couple of times. Did you talk about H353, the pharmacy benefits managers bill yet?
We have not.
Okay, no. Then I've got a couple of questions on that. I'm wondering if it has any legs. That's one question. And I know there's been some testimony, which I'm going to listen to in committee. And I'm curious as to which national organization created the model bill. If anybody can answer that.
I do not know. I'm just pulling it up now. It looks like Mari was Representative Cordes was the rep on that.
Yeah.
I don't know if anyone has anything.
It's a model bill, yeah.
I'd be happy to follow up a little bit with you later on it. We did put some energy into in the drafting phase in that bill. And I was in the room for the testimony that happened earlier. So there is some statement of interest in the committee from the House Healthcare Committee to move forward on that bill. Though I also want to recognize the calendar. Things are tight.
Yeah, I know. I would love to have a follow-up conversation with you, Mike, when you have a minute. Thanks.
Great. Does anyone else have something they'd like to ask questions from Sean or Michael on?
And can I also just say, since I'm in the building, Representative Smith, I'd be happy to chat with you more about the issue you raised.
Yeah, and that's actually coming out of last week's discussion, where we had a great discussion last week around addiction and recovery services for older Vermonters and issues and inadequacies where we're often thinking about a lot of young people. So definitely been kind of bubbling to the top in the Human Services Committee as well around our discussion. So definitely will be ongoing. Mm-hmm.
And since I'm here, and I'll just mention that there was some interesting testimony in the context of the Alzheimer's bill. I don't know if we call it that, but the bill over in Senate Health, the room I'm in. Was it in this room? I'm in Senate Health and Welfare at the moment. About the numbers of people in hospital beds awaiting nursing home placements who are hard to place. I think the number that was said out loud a week or two ago was 113 or something. And just to recognize it's not a new problem. We've known it for a long time that there are some people that are really hard to place because of their histories of violence or drug addiction or even criminal records. And it's another whole policy area that we should be paying attention to. And having those people stay in the hospital, filling a hospital bed is not the right answer.
Yeah, thanks for bringing that up, Michael. We've actually talked about in the Vermont Commission on Alzheimer's and Related Disorders with Meg in the past. And, that is definitely an issue that we should continue to be trying to figure out a solution for. So thanks for bringing that up. And I'm glad that bill is seeing some action in the Senate. So hopefully it will make it over before crossover for sure. All right. Anybody else have anything they'd like to bring up today? Otherwise, that gives us 10 minutes before we got to get back to committee. So Teresa and I, so thank you everybody for being here today. And we'll talk to you all probably next week. Sounds good.
Bye-bye.
Thank you. And thank you, Mike and Sean.
You're welcome. Thank you. Bye-bye.